Good evening. I'm Sister Catherine Ryan. I'm privileged to be the Executive Director of Maryville Academy, and we're here tonight for our monthly program, Children First. Last month, we were delighted to talk to you about our Maryville Scott Nolan Hospital, which serves children, adolescents, and young adults with psychiatric issues. This evening, I'm delighted to introduce Dr. Shiraz Butt, who is our Medical Director of the Maryville Scott Nolan Center. So, welcome, Dr. Butt.
Thank you.
Now, Dr. Butt, I want to start with this question that I've often had. What is the difference between a psychiatrist and a psychologist?
Well, it's a good question because, surprisingly, many people don't know that a psychiatrist is a medical doctor. So for a doctor to become a psychiatrist, they have to go through medical school. They have to finish medical school, and then they do training, which is 4 to 6 years postgraduate training after medical school. They complete residency in the field of psychiatry. A psychologist does not have to go to medical school. They go to graduate school, and usually, they obtain a postgraduate, a doctoral level degree in psychology. Now, there are some states in which psychologists can prescribe medications, but as a general rule, psychologists are not licensed to prescribe medication, whereas a psychiatrist can do so.
Well, thank you. So there are two kinds of knowledgeable professionals here. You are a psychiatrist, and actually you are recognized as a child psychiatrist. Is that correct?
That's correct. For a doctor to become a child psychiatrist, they have to complete training in general psychiatry first, and then they have to go through 2 years of further training as a child and adolescent psychiatrist.
So you have gone through all of this, and this is recognized in your profession through a board certification?
That's correct. After you complete your training, you are required. You're not required, but it's recommended that you certify yourself through the American Board of Psychiatry and Neurology.
And so here you are. And Dr. Butt, you are our medical director at Maryville Scott Nolan Center, and you are board certified in child and adolescent psychiatry. Is that correct?
That's correct.
Okay. So now for our listeners here, you may have some questions for Dr. Butt. I do need to give the disclaimer that Dr. Butt will not be providing, nor of course any medical advice for an individual person, but he will be able to help us with our own education about psychiatry and mental health issues. So I hope I've said that correctly, Dr. Butt. And now for our parents and our grandparents who are listening, our family members who work with mental illness in their families, can you speak a little bit about how the profession of psychiatry has determined diagnoses?
Well, I think the field has gone through tremendous changes over the last few years, and the issue of diagnosing mental illness is a complicated one because mental illness has not always been recognized as a true illness, and there's been a lot of misconceptions and myths about psychiatric illness. That has changed over the last few years because of our access now to new information regarding these disorders. I think the field of neuroscience has developed tremendously because of new techniques that we have for looking at the brain. So the brain scans, what we call imaging, where you can actually look inside a functioning brain, has allowed us to look inside the brains of individuals, children, adults and adolescents with mental illness, and see that there are real changes taking place in the brain. Also, I think there's been a lot of research and comparing these individuals with emotional disorders and seeing how they do over time. That has allowed us to really get a better handle on what these illnesses truly are. So in order to diagnose somebody, again, I think the approach is to do a thorough clinical interview, which means talking to the child, the adolescent, or the adult, and also getting a lot of information from their families about the problems they're having. Putting it all together in context is the job of the psychiatrist then. And also, if there are any medical tests that need to be done, any blood work or any other types of investigative procedures, those should be done as well. But this diagnosis is not a simple process. It takes time, and it takes an expert to really put a lot of information in its perspective.
Now, Dr. Butt, one diagnosis we hear a lot about is bipolar. Can you explain what that is?
Bipolar disorder is what used to be called manic depression, manic depressive illness, and it is a serious mental illness. It's considered to be a mood disorder, which means that it's a problem where the primary complaint is the swings in one's mood. So the mood shifts rapidly. Now, that by itself is not enough to make the diagnosis of bipolar disorder, because an individual's mood can vary because of a number of conditions. But in this case, we're talking about extreme changes in mood accompanied by other problems. An individual might not be able to sleep, they might lose their appetite, have trouble focusing. They also might involve themselves in really reckless activities. As the term bipolar suggests, there are two stages. So on one hand, they might really be in the state of mania, where they're really high, euphoric, really agitated, and can't sleep, have speech that's really pressured. They might also have problems with their thinking, where they might lose touch with reality, start hearing voices, start becoming real paranoid, or have delusions, what we call grandiose delusions, where they really feel like they have special powers. Now, this can be followed by severe depression, and there might be times when these people are leading quite normal lives. But it's considered a very serious mental illness because it's chronic. It can have severe consequences. The most concerning, obviously, is a risk to their own life, because suicidal behavior is very common in bipolar individuals. In fact, it's one of the leading causes of suicide. And so it has to be recognized, it has to be treated. Now, one of the reasons bipolar disorder has been in the news a lot is because of an increased diagnosis among children and adolescents. And I think that's really happened in the last decade, that our understanding of this illness in children has increased tremendously. A lot of research has been done. Some of it has been done locally in the Chicagoland area. And that's allowed us to really understand that children and adolescents can suffer from this illness, although its presentation might be a little different. But diagnosing bipolar disorder in children is not easy, and really requires an expert to, again, take into account a lot of information, interview the child, perform what we call a mental status examination, and then either diagnose the condition or rule it out.
So, Dr. Butt, if a parent, grandparent, a family member is listening to you now and believes that he or she has a family member, a child or an adolescent or young adult who may exhibit some of the symptoms you've just described, what should that family member do?
Well, I think they should immediately seek help. They really should contact a mental health professional. They can go through their primary care doctor or pediatrician and ask for resources. They can also call a mental health agency in their area and ask for what would be an assessment. So the first step is getting an assessment done, because this is not a diagnosis that can be made without a thorough clinical assessment. So the first step is to get a diagnostic evaluation done.
Now, I'm going to ask you about another diagnosis, but first I think we'd like to let our families know of a website that may be helpful to them if they'd like more information about mental illness. And this is the National Institute of Mental Health, and we have the website available here on the screen in case any family members want to look on that website. Actually, Dr. Butt, can you tell us a little bit about the National Institute of Mental Health?
Well, it's an institution which conducts research on mental illness, and it's a valuable resource. They have conducted, over the last several years, many research trials, which has helped us gain a much better understanding of mental illness and understand the causes of mental illness. Also help us understand the treatments and prognosis. How well somebody with a particular disorder will do over a period of time. And they fund a lot of research and have made some very valuable contributions to the field.
And in terms of the diagnoses that are very common with children and adolescents and young adults, what would be another diagnosis that you find is frequently made by doctors, psychiatrists working with the children?
Well, I think if you just go strictly by the numbers, you'll find that attention deficit hyperactivity disorder, known as ADHD, also, sometimes it's called ADD, attention deficit disorder, is very common.
And can you tell us what that is?
Yes, that's again another condition that starts very early in childhood. In fact, for somebody to make a diagnosis of ADHD, some of the symptoms, some of the problems have to start before the age of 7. So clearly, we're talking about young children, and usually the predominant issue is a problem with focusing. So these kids have a hard time sitting still. They can't seem to focus on tasks. Keep in mind, some of this is normative behavior. So you always have to put the problems in the context of normal development. That's very critical in our field. That just because a child cannot sit still doesn't mean that they have ADD, because it could be due to something else, and it could also be just that they're at the normal end of at the one end of the normal spectrum. Mm-hmm. But once you factor that in, kids with ADHD typically have a hard time in school because they can't focus, they can't sit still, they're very impulsive, and that usually leads to academic difficulties. And research has shown that if it's not treated, kids with ADHD will develop other problems when they hit adolescence. They might develop anxiety disorders, they might develop depression. They also have a higher rate of behavioral disorders, problems with substance abuse, and also legal problems. And it's primarily because of their struggles with this condition. If you cannot really focus, you don't always learn good social skills. You also don't learn how to, problem solve. And again, I want to mention that these kids have normal intelligence, so that's not a problem. The real problem is that their brains, the part of the brain that is involved with sustaining attention, seems to be a little bit dysfunctional. And so again, very treatable condition. We have, with good treatment, these children do just as well as any other child. And so it's important to recognize it early on and get the necessary treatment. I mean, we have some of the most effective treatments in, I think, the field of medicine for ADD. And so that's another very common diagnosis. Now, speaking of diagnosis, I think I should mention again that a lot of research in the last few years has shown that it appears that the psychiatric disorders in children and adolescents are on the rise, and a significant percentage of these children are suffering from emotional disorders. And again, I mean, it's difficult to really make sense of why that's happening. But I remember that a few years ago, the Surgeon General also mentioned that in one of his reports. And so I think it's important to know that a lot of our youth are struggling with emotional disorders, and it's important to increase the awareness and also to seek help.
I couldn't help but be struck when you mentioned that sometimes the condition begins before the child's even 7 years of age. And I know at our psychiatric hospital, Maryville, Scott Nolan Hospital, that sometimes we've had children as young as 3. Can you speak a bit, Dr. Butt, about these really young children who have severe psychiatric conditions?
Yes, unfortunately, that's true. We do sometimes get children as young as 3, and as difficult as it is for parents to hear that happens. Now, when a child is that young, it becomes even more important to really seek the right kind of help, because it is not easy to diagnose mental illness in a 3-year-old child. And the reason for that is because the brain has not developed yet fully. Also, a lot of the problems that a 3-year-old child displays could be due to normal development. So I think you really have to do a very thorough assessment. You have to take into account other environmental factors, whether there's something going on in their environment that's causing them to have these problems, because many of these disorders really do not have symptom criteria. We don't have enough research to really, for example, be able to diagnose many of these illnesses in children because they don't yet have the full language to talk about their symptoms. So we are relying a lot on external behaviors. But the truth is that now, the American Academy of Child and Adolescent Psychiatry has developed criteria for diagnosing, for example, conditions like post-traumatic stress disorder, depression in young children. You can also diagnose ADD, although again, keep in mind a 3-year-old child is hyperactive as it is. So
Right.
really the symptoms have to be extremely significant and cause severe impairment in their functioning. But again, the younger the child, I think the more thorough you have to be and the more careful you have to be in diagnosing a psychiatric illness. You definitely want to rule out any other conditions, like whether there's any abuse going on, whether there's any other medical condition, whether this could be attributed just to, again, abnormal development.
And doctor, let me ask you about one more diagnosis that we hear a lot in the public parlance, and that's schizophrenia. Could you tell us what that diagnosis is and whether you see that diagnosis with children, adolescents, and young adults?
Schizophrenia is what I would call a neuropsychiatric condition. Is really, I think, a chronic mental illness which usually starts in young adulthood, and it's disorder. It's what we call a thought disorder, which means it really primarily affects a person's thinking, and thinking becomes disorganized. They also lose touch with reality. They start to hear voices. They can get very delusional. It's a chronic illness, and it's an illness where there is some severe deterioration in their functioning over time. So it can really cause significant impairment and decline in a person's functioning. So they could be somebody who's functioning at a very high level, and after having what we call a first break, which means that they have an onset of the symptoms, we can see a very rapid decline in their functioning. So the treatments are, however, advancing rapidly. We now have medications to treat schizophrenia that don't have the side effects that previous medications used to have. So from that end, I think we have some significant improvements. But this is a condition which can affect person's thinking. It can also affect their intellectual functioning and their ability to hold a job because of the problems I mentioned. When they've lost touch with reality, it's hard for them to really be able to maintain normal functioning. But it's a chronic mental illness. It's a serious mental illness. There are changes in the brain that take place. Now there's a very strong evidence of what kind of changes take place in a schizophrenic brain. And usually the problems that these individuals have is because of their psychotic symptoms. They lose their social contacts, so they tend to isolate themselves. They can't hold a job, so really there's a decline in their socioeconomic status, and that can sometimes lead to isolation, homelessness, substance abuse. So again a serious condition.
Well, I appreciate that you're explaining what some of these conditions are, because we know that most families have contact with some form of mental illness, and we all, of course, want to reach out to our loved ones and make sure that they receive the proper care. So now, Dr. Butt, I'm going to ask you to give us some hope, which I think you've been doing in some of these explanations. What success can we have if the family members, the children, the adolescents, young adults, do receive proper treatment?
The key here is early intervention. I think that it's absolutely critical that when a child or when a parent is concerned about their child, that they seek help, because more than anything, we know right now that the treatments we have might not be perfect, but they are good treatments. There are interventions that if you intervene early in some of these conditions, for example, in ADHD and depression and bipolar disorder, that you can make some significant changes in the course of the illness, which means that you can prevent bad outcomes. So you can help them get for example, you can help the school understand this, so that the child can receive specialized help in school, and they can really understand that these are not bad kids or they're not lazy kids, but because of their mental illness, their academic functioning is being impaired. So the school can develop an individualized educational plan, for example. Also, through medications, you can control the symptoms. You can do social skills training, you can do counseling, you can provide support for the family, and all of these are very critical because mental illness not only affects the individual who has it, but also the family. And I think that's the impact that you have. You're affecting the entire family. You're also affecting, the larger society through that impact. So, early intervention, recognizing the illness early and treating it early is critical. Many of these conditions are very treatable.
Well, I think that's a lot of hope, Doctor, that you've just said, that these conditions really are treatable, and that there is a possibility of helping the family member, the child, the adolescent, or the young adult get better. I want to share also then a support group, the National Alliance on Mental Illness, that families can reach out to if they would like to find some others families who are facing some of these same situations. And now, Dr. Butt, I want to ask you about the treatment that you're able to provide at our Maryville Scott Nolan Hospital. You've talked about treatments that can be provided for the children, and I'm assuming, but I want to make sure we say it here, that most times children, adolescents, and young adults will be treated while they're in their own homes. Would that be correct?
When children are admitted to Scott Nolan Center, they're usually going through a crisis. So once that crisis is stabilized, once we've treated them, we provide recommendations for the follow-up that they will need upon discharge, and then they go back to their homes or to the other placements that they come from. So that's correct.
Oh, thank you. You clarified what I was starting to ask. I meant to be saying most times children won't ever need hospitalization. They'll be able to be treated in their homes and communities, but sometimes they need hospitalization.
Right.
Would that be correct? And then when they do, what you just said would be what applies, that they come into the hospital. And do you involve the family in the treatment while they're in the hospital?
Always. I mean, there's one rule in child psychiatry is that you cannot treat the child alone. You always involve the family, and if the parents are not around for some reason, we also treat children who are wards of the state. Then you involve their support groups. You involve whatever support system that they have. But involvement of the family in treatment is absolutely critical and a part of the treatment plan.
So now, Dr. Butt, is there something that you would want to say to the family members who are listening that I've not given you the opportunity to say by my questions?
I think it's important to educate yourself. I think awareness is the key. Almost everybody who's watching the program will know somebody who has an emotional disorder or psychiatric illness. So these are common conditions. So I think increasing your awareness of these problems is important for the general community, because help is there, and also I think dispel some of the myths that exist out there about mental illness, that it's not real, that people make it up. I mean, the impact of these illnesses, of these disorders, is far greater sometimes than even physical disorders, and the suffering is huge. And then the consequences, like I said, we didn't talk much about suicide, but suicide is one of the leading causes of death in this country, in the younger age group, and also in the elderly. So we have to clearly increase our awareness of these conditions.
So what we want to say to our family members who are viewing tonight is that it is possible to have an assessment of a child, adolescent, or young adult who's demonstrating some of these symptoms. It is possible for mental health professionals to determine what much of the problem is and what a good treatment is, and our children can get better. Is that fair to say, Doctor?
Absolutely.
So I want to thank everyone who's been with us tonight. I want to thank Dr. Butt in a special way for helping us. Maryville Academy is presenting Children First because we are about rebuilding lives, rekindling spirits, and renewing hope. Thank you.